So good evening to all. For those of you that may not be familiar with me, I am Dr. Felicia, physiotherapist and certified health coach, and I teach Black millennial women how to age with grace by making changes to their eating and movement habits so that they can enjoy a fabulous future. I am also the visionary leader of Adley Physiotherapy over on Mackey Street in the Mackey Street Plaza. I have a bachelor's degree as well as a doctorate. My doctorate is in physical therapy. I studied in Erie, Pennsylvania at Gannon University. All right, and then I made my way back here to the sunny islands of the Bahamas to help others to reach their health and wellness goals. So I have been a therapist for almost 9 years now. This month actually makes 9 years. And over those years, I have helped hundreds of patients reach their physiotherapy goals. I'm also recently a certified health coach. And so that enables me to help even more persons, not just reach physiotherapy goals, but also reach health and wellness goals. Okay, because what we want to do now is help people before they get to the stage that they need therapy. Someone says that they can't hear me. Hang on. Okay. My volume is up. Make sure that your volume is up on your device also. All right. So getting ready to jump right in here. Is that any better? Okay. Someone says that they can hear. The person that says that they can't hear, try to just turn your volume up and see if that helps. All right, so how to avoid leg pain while getting fit. Before we jump into the material, of course, any information that I do provide you with during this broadcast cannot be taken as medical advice. It is not individualized advice. Without me being able to evaluate a person, I can't give them medical advice. So please do be aware and advised that any information that I'm sharing with you is just for your further knowledge. Okay. And if you want something that's a bit more individualized to you, then please do feel free to reach out to me in the DMs or by sending me a message. Okay. You can also instant message on Facebook. All right. Okay. All right. I think the volume issue got sorted out. Hi, Tanya. How you doing? Good to have you on. All right, so we're just jumping into our topic here. And the topic this evening is how to avoid leg pain while getting fit. So we're talking about shin splints this evening, and it won't be a very long presentation. I won't keep you too long this evening, but I'm going to give you some good information that hopefully you can put into practice. All right, so shin splints is also known as medial tibial stress syndrome, and this is pain and inflammation along the inside of the tibia or shin bone. So that's the part of the leg that is beneath the knee, okay, beneath the kneecap. So this can affect the muscles, tendons, and bone tissue, and it's considered an overuse injury. All right, so causes of shin splints or tibial syndrome: repetitive stress on the tibia and tissues that connect muscles to bones. Okay. The pulling and tugging of the muscles and connective tissues cause repeated stress to the tibia, okay, or shin bone. Symptoms of shin splints include tenderness, soreness, pain, and some mild swelling. And these would initially be alleviated by resting, but they could also eventually become continuous if the bone is not allowed to heal. So this is kind of like where that overuse comes in. So over time, the problem could get worse if left unchecked. Risk factors include things like being a dancer, being a runner, having flat feet, high arches, or rigid arches, because muscles and bones may not absorb and distribute the force evenly. So any arch that's not like a normal or a regular arch, too high, too low, or rigid. Okay, also included under risk factors, suddenly changing exercise or training routine with regard to duration, frequency, or intensity. So any sudden change, okay? So like you used to walk for 15 minutes, then you decided you were going to start running for I don't know, 3 miles or something like that, could cause an issue, right? Hi, Bahama Veg. Thanks for joining us. We're having a little conversation about shin splints this evening. All right, so we were talking about risk factors. Risk factors for getting shin splints could also include being in military training because of all that marching and or walking. Also, running on hills, uneven surfaces, or hard surfaces like concrete. So it's not the best idea to be running on very, very hard surfaces. Okay. People with osteopenia or osteoporosis because they are already prone to having weak bones. Also, having vitamin D deficiency, eating disorders, or loss of normal menstruation. So, I thought that was an interesting point. So, the vitamin D deficiency, which I would say is also going to be related back to like bone health and bone strength, because of course, vitamin D and calcium go hand in hand. Okay. And of course, calcium is important to bone health. All right, so how do you treat? How do you treat shin splints, right? So it's important to give shin splints attention. The shin splints could lead to a stress fracture of the tibia if it is not treated, okay? And treatment include things like icing, rest, and over-the-counter pain medication, just if there's any kind of lingering pain that you can't handle and you need a little something to take the edge off, right? So those are some of the main treatments. Very simple. The main thing is with any overuse injury, even if you think about a tendonitis, the main thing is that you're going to need to rest it and stop the offending activity. Okay. So whatever is bugging it, you got to back off of that for a while. If it's the running, then you have to back off of it for a while. All right. So how to avoid shin splints. Okay, so I'm going to give you a couple of points here that you can put into practice, something to keep in mind so that you don't end up with this condition. Number one, wear proper supportive shoe wear. Runners should get new shoes every 350 to 500 miles. So we know that a lot of persons are guilty of this. We may sometimes wear shoes way past their expiration, right? They're all worn out. But those feet, your feet really need support, okay? It's a part of a biomechanical chain. They need support. So again, it goes back to, and we're going to talk some more about the arches as we go through these points as well. But your arches need support. So you can't be wearing a shoe that's all worn out. Okay, so every 350 to 500 miles, runners should replace their running shoes. Hi, Jay Wolf Fit. Thanks for popping in. Okay, we're just giving a couple of points here about how to avoid shin splints. So you've come at the right time. Number two, modify your exercise routine gradually. So I spoke just a moment ago about not doing too much too soon. I think some people are guilty of this. Sometimes it's because of excitement. Sometimes it's because people have been injured and they want to get better faster. So they feel like more is better. I see that quite a bit. Sometimes in my patients, and I would have to like kind of slow them down. Okay. So, and that could happen. Sometimes the person will come and they'll say, "Oh man, my knee is really, really killing me." Okay. Well, what did you do? Nothing. Okay. So what was different about the last couple of days? Oh, I walked for an hour. That was probably it. Okay. So you got to scale it back. Try not to make any sudden changes to your exercise or your fitness routine. You want to build it up gradually. Okay. So any changes you're going to make should be gradual changes, not like a 180 from what you were doing currently. Okay. So number three, wear arch supports, especially if you have flat feet. Okay, that's going to be a bit of an issue, if you're doing a lot of that vigorous activity and your arches are just flat down to the ground. Okay, arches really do need support, whether they are flat arches, high arches, or even rigid arches. Having some insoles and some arch supports would be a great idea. Number four, have a PT, physiotherapist or physical therapist, which both terms mean the same thing. Okay. Do a movement analysis with video. Okay. So they could literally tape a person while they're running. And this could easily be done even indoors on a treadmill. Have the PT film it and then analyze what they basically take note of while the person is running. So that one is really, really helpful. And that way some adjustments can easily be made that could help prevent something like shin splints. All right. Participate. This is number 5. Participate in strength training, not just for the legs, but the core, hips, legs, and ankles. And remember, please, that the core is not only abdominal muscles, the core is also your back muscles as well. Okay, so your obliques that are back there, your uh, back extensors, okay, all of those count as the core. All right, so remember, strength train, core, hips, legs, and ankle muscles. Okay. Number 6, wear shock absorbing insoles. Okay. The shock can also tend to be a bit of an issue when it comes to that constant pounding. So when you think again about that running, okay, that tends to be an issue. Okay. So you need something to help and absorb the shock so that the shin bone isn't taking all of that repeated pound, pound, pound. So number 7, don't overdo it. Too much running or high impact activity, even things like jumping for too long or too high of an intensity, can cause overload on the shins. Okay, and for anybody that is trying to think about some other ways that they could potentially get fit, that brings me to number 8. Last point. Participate in some low impact. Hi, Kara. Participate in some low impact exercises or sports, things like swimming, walking, biking, and remember to start slow and build up. So when you think about all of those examples or options just there, those are things that are not a lot of like that pounding. It's not like running where it's that continual just pound, pound, pound. They're all low impact, low shock. So they're going to be nice rather than a person that maybe just goes running every day. Mix it up, cross train, do some other forms of exercise. Still try to pick something that you like so that you can enjoy it. But I would highly advise that you mix it up, include some other things, okay? So let's see. If you're looking for some ideas for some other things that you can do, uh, dancing is another culprit, actually. So persons that dance, that one can be an issue as well. So if you're looking for some additional ideas for like how to cross train or do some other form of exercise that perhaps isn't that running or that jumping, that's that constant shock on the shin bone so that you can avoid shin splints, then you can download the checklist 50 ways to get fit this fall at bit.ly/get fit this fall, bit.ly/get fit this fall. And if you are not on Facebook and you're on Instagram, you can actually click the link in the bio and just go underneath the download section, and you're going to see 50 ways to get fit this fall there. Believe it or not, it is still fall time. It's actually still fall time until like well into December. So we've got a couple of weeks left of fall. But if you wanted to get this checklist, please do feel free to go and download it. I will go ahead and I'll probably be archiving that list really, really soon. Once fall time ends, I am going to archive that and that won't come back again until next year. So if you're interested in seeing what is on that list, then please do be sure to either go to bit.ly/get fit this fall, or you can go to the link in the bio on IG and you can click 50 ways to get fit this fall under the download section. Okay, so also if anybody has experienced symptoms like this or want to get something like a movement analysis or want to do some prevention so that they can do some strength training, okay, please do feel free. You can DM me if you need to find out how you can get on my therapy schedule. Please do feel free to do so. I will quickly recap the 8 points for persons that may have joined a little bit later in the broadcast. So very quickly, wear proper or supportive shoe wear, and this is for how to avoid shin splints. Modify any exercise routine that you do gradually. Wear arch supports for flat feet. Hi, Scorpion 67. Scorpio M67. I think I got that right. Okay, so fourth way to avoid shin splints, have a PT or physiotherapist, do a movement analysis using video. Number 5, participate in strength training for the core, hips, legs, and ankles. Number 7, wear shock absorbing insoles. Number 7, don't overdo it. Too much running or high impact activity is just going to be too much overload on the shins. And number 8, participate in some low impact exercise or sports. So don't just do all high impact, mix in some low impact things as well. All right, that is basically my presentation for this evening. Just a couple of end of broadcast announcements. Please do be sure to like, follow. We are not only on Facebook and Instagram. Adley Physiotherapy is also on TikTok. We are also on YouTube, so you can go ahead and like, follow, subscribe, share anything that you think is useful for other persons that you may know, but that may not know about me.